Welcome to the latest edition of AI in Healthcare and Digital Health Update, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. First, research integrity made headlines. An analysis by GPTZero of 4,841 NeurIPS 2025 accepted papers found at least 100 fabricated citations across 51 papers, including fictitious authors, invalid DOIs, and incomplete archive IDs. These papers passed multi-reviewer peer review in a year with a 24.52% acceptance rate. The finding underscores pressure on conference workflows and the need for stronger citation checks. Next, ARPA-H is launching Advocate to build 2 agentic AI systems for cardiovascular care. One is a patient-facing agent for always-on support. The other is a disease-agnostic supervisory agent for ongoing monitoring of learning systems. The aim is an FDA authorization pathway over 39 months. Teams are slated for selection around June 2026, with capabilities that connect to EHRs and wearables, help schedule visits, and suggest medication adjustments under clinical oversight. In imaging, Bristol Myers Squibb and Microsoft announced a collaboration to accelerate early detection of lung cancer. FDA-cleared radiology AI will be deployed via Microsoft's precision imaging network, which Microsoft says is used by more than 80% of US hospitals to share imaging and access third-party AI. The tools can surface hard-to-see lung nodules on X-ray and CT and track follow-up to reduce loss to care. The effort targets earlier diagnosis and access in underserved settings. Lung cancer remains the leading cause of cancer death in the US, with about 125,000 deaths and 227,000 new cases each year. OpenAI detailed how its business scales with compute. Available capacity rose from 0.2 gigawatts in 2023 to 0.6 gigawatts in 2024 and about 1.9 gigawatts in 2025, while annualized revenue rose from $2 billion to $6 billion and then to more than $20 billion. The model mixes consumer and workplace subscriptions, a free tier with ads and commerce, and usage-based APIs, with a 2026 focus on practical adoption and agentic workflows. OpenAI also invested in Merge Labs, Sam Altman's brain-computer interface startup. Merge raised about $250 million at an $850 million valuation, with OpenAI writing the largest check. Merge is pursuing non-invasive interfaces that use molecules and modalities like ultrasound to communicate with neurons. This contrasts with Neuralink's implanted electrodes, which require surgery. Google introduced Gemini Personal Intelligence, a US beta that lets users opt in to connect Gmail, Photos, YouTube, and search for more personalized help. Google states connected data is referenced to answer requests with controls to choose what to link, and that it does not train models directly on inboxes or photo libraries. The feature starts with eligible AI Pro and AI Ultra subscribers and will expand over time. Finally, Anthropic advanced Claude for healthcare and life sciences. HIPAA-ready tools now include connectors to the CMS Coverage Database, ICD-10, and the National Provider Identifier Registry, supporting tasks such as prior authorization checks, coding, and provider verification. For life sciences, new connectors include Medidata, clinicaltrials.gov, bioRxiv, medRxiv, OpenTargets, Kemble, ToolUniverse, and Okin. Anthropic highlights improvements with Opus 4.5 on medical agent benchmarks, plus skills for FHIR development, and a sample workflow for prior authorization and clinical trial protocol drafts. Stay ahead in AI in healthcare and digital health. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting.